Hi there. You are listening to the Perio Patient Podcast, a podcast for my patients and anyone else who cares to listen. Dr. Ben Young here, and I am a periodontist in private practice here in beautiful San Antonio, Texas. The title of this podcast is, and it's number 71, Comfort and Sedation. I have taken this title from the first subheading under the tab on my website we call Periodontal Services. This is because as the Perio Patient Podcast has developed, as part of my push to continue to communicate with you, my patients, regardless of whether you are currently under care or have moved back to receive most or all of your care in your home or family dental office, I have moved to place these podcasts based on their topics into the different areas of my website. This actually came out of an idea I had of a mobile app, but if I created a mobile app that had the podcasts and elements of the website and all of that, which may still happen, I don't know, I thought, well, the first thing to do is to see if I could make my website the equivalent of the mobile app I had envisioned. And so with that, I've moved these podcasts into the areas of the website. Anyway, that's a little background. The hope for new patients is that it might help them hear from me what it is they're reading on a particular page. And for the rest of you, it will be sort of a review with perhaps something you didn't know thrown in. I know I repeat often why I do this, and the answer is that in our busy lives, with the work we all need to do, you out in the world away from my office, and me in my office moving from patient to patient, we don't have the luxury of just sitting and talking. And yet, sometimes the most important thing we can be doing is talking and sharing about what is important to us. For example, I wrote The Joy of Flossing because I found I did not have the time to explain as well as I wish I could during patient visits the profound importance of this little seemingly unimportant daily habit in keeping people healthy with regards to the two most destructive diseases dentists face every day: tooth decay and periodontal disease. So I wrote the book because I couldn't just give it up. It's too important for the health of so many people. And yet I also knew that I couldn't give it my best in the few minutes I had available with each patient without messing with the appointments of other patients. I guess I'm a teacher at heart who also wishes to maintain a level of independence from bureaucracies, because I understand how easily they can control speech and behavior. If I were working within a university environment today, let's say I was doing research, it may not necessarily be the research I would want to do. I would need to find the research that could be funded. Because I know this, I am a skeptic whenever I hear there is a consensus of scientists who believe one thing about anything. I'll leave it there and let you figure out the rest. The bottom line is that I believe it is critical to have independent voices speaking into society, especially today. And this is not to say that there aren't those who are doing an outstanding job speaking truth within institutions today, but it is not without its personal risks, especially if you are younger in your career and wanting to obtain a tenured professorship, for example, or that higher rank if you're in the military. For me, at my age and station in life, I have an easier time being able to be as honest as I can be. But I do recognize that for others, they are under constraints. And when it comes to you as a patient, I believe you will receive the best care when you are curious, do a lot of reading, even if it's on the internet, where there's always a lot of bogus stuff, and you use people like me and your primary care physician, your nurse practitioner or physician assistant, not as your health decision makers, but first and foremost as your health consultants. This is really fundamental. You have to retain your ability to decide, and your decisions, if they're going to be good ones, should come only after you understand the problem and all reasonable options at the level that will allow you to relax. Which conveniently brings us back to the topic of this podcast, comfort and sedation. So, what I'm going to do now is simply go down this list of topics on this page on my website and make a few comments as we go. First, patients have discovered that my dental chair vibrates. I wish I could tell you that I planned this and purchased the chair because of this feature, but I actually did not know it had this feature when I bought it. It was shipped from Florida a number of years ago when its predecessor gave up the ghost. Some people like it. Some people could care less about this feature. What you need to know is that you are welcome to use it or not, and that it doesn't bother me in the least as I do procedures. I will say this, I have never used it myself because I might like it so much it will distract me from the work I need to be doing. So that's the first comfort amenity mentioned on this page. Plus, I think it's a fun one. In the treatment room, we have an air filter that filters out particles the size of viruses. This is one of the contributions of the COVID events that I like, and so it will stay there. And we also have a fan that we can point at people if they become uncomfortable. We can cool them with a fan. Obviously, we have air conditioning. In addition, we have blankets for wintertime or if somebody is just cold. And we also have small pillows that can help support the neck if you need this. Please let us know if you have limitations in sitting back or how you get up and back comfortably. Some people need to go slowly. I need to be in a certain position in order to work comfortably myself, so we are going to work this out between us so we're both as comfortable as we can possibly be. Now let's talk about music. Depending on when you visit, you will hear music playing that may be the 40s. We have someone that loves big band in our group. The 50s, Elvis. You might hear 60s, the Beatles, 70s, and country music, as well as I think a few more modern sounds, popular tunes. Heavy metal is not a favorite, and most rap music I have not found conducive to relaxation. My personal favorite is classical and easy listening jazz without words, but I am in the minority. So when it comes to music, the first thing you need to know is that you, the patient, gets to pick. If you like heavy metal and you are the patient, then heavy metal it is. Also, if you like Christian music, that's great. Every one of us in the office do as well. Just ask for it. Also, I'm never opposed to praying out loud for anyone who requests this as well. I'm very much aware of how important it is for God to oversee and heal people. My skill set is to enhance the body's healing abilities, but I am just an instrument in the healing process. I believe God is ultimately the one who heals all of us. Sometimes he just chooses to allow others of us to participate in the work he is doing. Let's go to the items under minimally invasive treatments next. The first one is dental laser for periodontal disease treatment. I guess this one is here in case someone has yet to look at the tab that is entirely about lasers, but I'm not going to remove this as a topic here because one of the things I love about the laser I work with is that it is truly minimally invasive compared with surgeries that require exposing bone. Lasers alone are not the answer, as you will learn if you do not already know, but their contribution to other procedures is on the level of amazing. Lasers can reduce the number of office visits someone would have to schedule, and also the costs compared with other options can be much lower overall. Also, lasers can treat more than periodontal disease. If you have mouth ulcers, for example, come in and in a few minutes, we can usually relieve the pain and speed up the healing. So, next, what is a non-traumatic extraction? A non-traumatic extraction is one that preserves the surrounding bone. In other words, if the tooth has to come out, then the objective is to remove the tooth but keep the rest of the bone behind because we need it. To do this, the tooth is often sectioned and removed. It takes a little longer, but since you're going to be sedated, if I take out your tooth, it won't matter to you. Beyond a non-traumatic extraction, additional comfort can come with a bone graft. This is particulate bone placed into the socket, which covers over all the exposed nerve endings. Bone grafts can essentially eliminate the risk of dry sockets, something I used to see all the time before bone grafting became an important discovery and then available for routine care. It is not uncommon, in fact, it's desirable. Anyone who wants a dental implant and they need a tooth extracted first is to graft with bone. Sometimes we can place the implant immediately, and I go into this in another podcast and in other areas of this website, so I won't go further here. Let's talk about gentle injections. I was taught to give injections by a particular instructor in my dental school by the name of Dr. Larry Day. He was an oral surgeon and one of the gentlest men you would ever meet. His belief, which he passed down to us students, was that the slower the injection, the more comfortable. The reason for this is that the injection, when it starts, enters the skin just below the surface. It isn't a jab. Once below, a drop of anesthetic is delivered. This numbs the area ahead of the needle. The needle from that point on moves within the numbed area of tissue. There are other techniques, and I won't bore you with them, but the bottom line is that most dental injections can be delivered in a way where they are barely felt. Having said this, it is unfair to promise anyone they will not feel anything. I've had patients react to injections before the needle has actually touched the skin at all. What this tells me is that the imagination can be our worst enemy. Finally, and this is most common with children, is that when they think they're going to get an injection, they almost instinctively look at the needle. Discipline yourself to close your eyes or look away. You will find that the injection is barely felt at all. When I have blood drawn, I do not look at the needle going into my arm. I have, and I can do it. In fact, I've helped a lot of people learn how to start IVs and things using my own arms. But why should I do this if I don't need to, if I'm not training somebody? I prefer to just relax and let people work on me when they have to. Next, let's talk about platelet-rich fibrin. One of the newest techniques today is not only in dentistry, but orthopedics and plastic surgery, and it is called platelet-rich fibrin, or PRF. Before PRF, we had to purchase specific growth proteins that are very effective in stimulating healing, but are also quite expensive. This is also true when it comes to materials we call membranes. Sometimes after a non-traumatic extraction and socket preservation bone graft, we cover the site with a membrane. This protects the socket environment. Membranes come in two types: those that dissolve over time, so you don't have to remove them later, and those that do not. There are reasons for using both of them, but I won't go into that here. So now, however, we have this very cool and less expensive option that is called PRF. Blood is drawn from a vein in your arm and is spun down in a centrifuge we have in another room. This separates out the blood platelets, white blood cells, and clotting factors from the red blood cells. This part of the blood, now rich with platelets, white blood cells, and clotting factor, enables us to create membranes, plugs, and even incorporate the bone graft material into the PRF. What we then can place is a material containing your own infection-fighting cells, as well as a concentration of the proteins that start the healing process. The net result is a better healing event with less cost in materials. Let's now talk about sedation options. In general, understand that pain is controlled by the local anesthetic. Sedation has only to do with someone's level of awareness during procedures. For some people, a dental anesthesiologist is the best option, and I work with a number of outstanding, highly skilled, and highly trained practitioners. With a dental anesthesiologist, we can go to the level of general anesthesia. I'm not trained to that level of sedation and general anesthesia, and even if I were, I would either provide the anesthesia or accomplish the dental procedure. I would not wish to do both at the same time. So for me, I will stick with what I already know and do well. Oral conscious sedation is the use of tablets you swallow to relax. This is sort of easy, but it has a slow onset. You would need to come into the office and you would probably sit in a chair for 45 minutes, perhaps an hour before ready. This is a downside. The other thing is it has a slower recovery rate compared with IV sedation. Also, our ability to titrate the level of sedation with oral sedation is almost not there. In other words, for one person, they could take the tablets that are our maximum amount that we would give and not be sedated at all. Others, that we give them a little and they're going to be very sedated, but we don't control that. It's certainly a backup option for those where I may not be able to start an IV. So I have oral conscious sedation tablets, but they're not my mainstay. IV sedation is a tremendous adjunct when it comes to dental extractions. Some extractions, especially those where there is some level of infection involved, and this may not be known by the patient, but this kind of extraction can override the level of pain control of a local anesthetic alone. For this reason, I personally sedate everyone who requires extractions. As for the use of IV sedation for other procedures I perform, this is all up to your decision. You can choose. If you wish to be sedated, it is available. However, for most LANAP procedures that I do, most of them that are not involving extractions, of course, patients simply elect to have the local anesthetic, and they trust me that I can provide this to them comfortably. I hope you will trust me too. It is never wrong to have someone else drive you from any lengthy dental appointment. However, it is not legally required if you are not sedated. If you are sedated, then you must have someone driving you, and you should not drive or operate machinery for at least 24 hours following sedation. This is precautionary. Besides, if you get in an accident and you are completely awake, say, but you were sedated within 24 hours, your insurance company, if they learn about this, would probably deny your coverage. Well, that's what I have for you today. Thank you so much for listening. I hope it has been helpful. If it has been, or if it has not been, please let me know. That way I can provide content that you and others will find most useful. And please like or give me 5 stars or whatever. That raises the awareness of other people being able to find this podcast should they be needing it. This has been the Perio Patient Podcast, and I am still Dr. Ben Young. Thank you for listening. Have a great day. Bye for now.